with trends in any space, right? There's the stuff that's top of mind that everybody's talking about, and then the other stuff that's kind of flying under the radar and people are kind of sleeping on, so to speak, right? So for example, everybody's talking about AI and the uses of AI, and that's
Yeah.
there's a lot of both signal and noise about that, if we're honest, right? But I'm curious from your perspective, because you're having conversations and you're getting deep into this subject, what would be some of the lesser known trends in healthcare right now? The stuff that's coming up, the stuff that you think is going to be much more prominent in the coming years, but is not being talked about right now?
Yeah, I think one of the biggest ones has to do with the data that all this technology is giving us. A lot of times, and this is, there are companies that have raised billions and billions of dollars in, Series A, Series B rounds on the premise of data analytics for healthcare. And that's great and that's good, but it's really large institutional data that those companies are managing, right? Big research hospitals, big health systems. There's a lot of opportunity I can't remember the exact percentage off the top of my head, but in like physiotherapy in the United States, something like almost two-thirds of the physiotherapy clinics in the United States are small privately held clinics. So that's a huge swath of data that's not being accounted for. Maybe we're getting it here and there and it's siloed. So in my opinion, if I'm looking at what's really going to be game changing over the next 5 to 10 years, is going to be some kind of tool or some kind of platform or some way to leverage technology that integrates all of that data from all these disparate little places into one unified area, one unified dashboard or something like that. One that's able to integrate with all the other EHRs and stuff like that would be wonderful. And kind of in that same piece is like, in all of these private clinics, in the healthcare tech space, especially in the United States, we've got all these solutions popping up, especially in the clinic. Some on the data management or like the practice management side, but specifically like clinical tools, for assessment or for treatment or something like that. They're all popping up and they're all getting deployed, which is great. The problem is a lot of them, mostly all of them, are point solutions. So it's like all of your data for, let's call it, maybe it's hand therapy or maybe it's, cancer therapy or whatever it is all being housed for this one piece of software, right? It's very much a point solution. And kind of to the point about data and integration into the larger picture, point solutions are only so valuable um, to large organizations in the fact that they're able to deliver currently, the fact that they're able to deliver that specific treatment or specific service to a specific population. But you need a way to kind of back that out to kind of get a big picture of it. So again, kind of like my view here and what I'm looking for is like something that's going to be the hub, if you would, like a digital hub for a hospital system that brings together all of the data points from those point solutions into one interface, right? That would be really ideal. And I think even the companies, a few of the VC firms that I've had conversations with over the last couple of months are really looking for that. They understand that point solutions are out there right now in the marketplace kind of by necessity because there is no integration yet. But down the line, the companies that are going to be getting large investments and really get some institutional money behind them are going to be organizations that either tap into a digital hub of some kind or the one that creates it.
That's really interesting. So, one thing that I wanted to fill in to kind of build a picture in my mind, I'm wondering, so for example, in the realm of physiotherapy, what kind of data is there actually? What kind of data points are we talking about here, and how is it collected currently?
Yeah, so you've got everything from like clinical outcome measures that are taken at every, evaluative note. So they're, a lot of standardized measures. So for shoulders, for example, you could use a quick dash or something, which is a disabilities of the hand, disability assessment of the hand, shoulder, and hand or whatever. And that's like 11 questions. It's all standardized. You get benchmarks and all of that. So there's something like that for almost every diagnosis out there, different clinical outcomes that are being taken at various points throughout the care cycle. So that's one chunk of data is all the outcome measures, clinical outcome measures. Then you've got stuff like the amount of actual completed visits, billable metrics, the actual units themselves, the codes that are being billed, the patients at it, like I said, we use the care survey, stuff like that. So you have all of these pieces of data that are being collected, usually in the EHR of that practice. There are some companies like Photo is one that FOTO. There's like an outcomes management, data management for practices that kind of tries to integrate it all and gives you a report. But for the most part, these pieces of data are being stored really just kind of as raw data in a lot of the EHRs, and they're not being utilized because it's just sitting there. And well, we have to pull the quick dash for every patient that's ever been to our clinic or whatever. So that's kind of how it's being housed now. And there are, like I said, some companies like Photo that kind of pull some of that and aggregate it for the clinics, and you can kind of get granular, the quick dash scores for Raffi versus, Sarah versus, clinic A, B, and C. And there's some tools like that that are out there that are starting to really be used by a lot of clinics across the country.
So I'm wondering if that is what you're saying, that this trend of centralizing the data is what I would label it as. I wonder, for somebody running a medical practice, what do you think they can do now or soon to prepare for this upcoming trend?
Yeah, so a lot of it would be understanding what key pieces of data or metrics you're wanting to track. So maybe it might be a specific clinical outcome. It might be a specific like length of care is probably a good place to start. Like how long is a patient typically involved with us for a course of care? So pick those things that you want to track, and it should probably be like one metric about like clinical operations and efficiency, one metric about patient satisfaction engagement, and one patient about clinical, or one piece of data about clinical outcomes. Find out where you're currently tracking that, or how that's currently being tracked or logged in your system. And then be on the lookout for tools that are going to come up that will help you integrate that or aggregate it all. So it might be for the first, there's nothing out there about managing this particular metric. So we have to create a dashboard that's, old school Excel or something like that, right? But there are getting tools that are coming to the market that you can input the data in and it aggregates it for you. So I would say the first step would be understanding those three areas, like I mentioned: clinical efficiency or operations, patient engagement, and then actual clinical delivery or outcomes. The pieces of data, or the benchmarks that you want to track, where that data resides currently in your system, and then start looking for tools that help you integrate, aggregate, kind of visualize all of that data so you can begin making decisions.